Hello, everyone. Welcome to the Advancing Healthcare Leadership Competencies webinar. This webinar is sponsored by the Leadership Management Governance Project, which is funded by the U.S. Agency for International Development and led by Management Sciences for Health. We are going to mute everyone's lines for the presentation. If you have any comments or questions at any point, you can type them into the chat box on the bottom right-hand corner of your webinar window. The presentation will run for about 30 minutes, after which we will take your questions. And we are recording this presentation, and it will be available on the LNG Project's website afterwards. The address of our website is www.lngforhealth.org. We have 3 speakers today. 2 of them are here in Arlington, Virginia with me. Our first speaker is Jim Rice. He is the Managing Director and Practice Leader of the Governance and Leadership Practice of Gallagher Integrated. And Jim is the former Director of the LNG Project. Our second speaker is Lucy Nugent. Lucy is the Vice President of the Health Management Institute of Ireland, and Lucy is joining us today from her office in Dublin. And our third speaker is Temitayo Ifafore-Calfee. She's the Health Workforce Technical Advisor in the Global Health Bureau at the U.S. Agency for International Development. And with that, over to you.
Good day, everyone. Thank you for joining us on this webinar. We're going to be moving through a flow of discussion that you see on your screen. We'll look at the call for stronger leadership development in all nations, both those that are well-resourced and members of the Organization for Economic Cooperation and Development, OECD, but particularly we'll be focusing in on the 50 countries that would be considered low or middle income countries and looking at the role of competency-based leadership for their health systems. I will be sharing some observations with you about some of the scope and challenges for this work. And a lot of the country challenges are rooted in the fundamentals of the changing demography, some of the complex requirements of this changing set of populations. All countries are worried about the excessive costs for delivering health care services, and many countries are not investing enough in services that prevent disease and promote health. And so this balance between acute care and population health or health protection and health promotion compared to health restoration is a challenge that every country is facing. Both those in the developed world and those that are developing their economies are struggling to deal with the bimodal challenges of high communicable disease and injuries, as well as now increasing chronic disease and the burden that that places on their workforce, which we know we see huge workforce shortages, and also on the economic vitality of their health system. And every health system in the world is struggling to find enough resources to respond to the changing demography. So in the target countries to which this webinar is directed, we see the challenge of a high proportion of young people that face communicable diseases and a growing percentage of the population that are older and are facing chronic disease. So we have complex system requirements where we cannot just deal with the simple managerial approaches. And many of the health systems in all nations are often led by people with clinical background that have not had training to deal with management and problem solving and supervision and financial development and mobilizing financial resources and human resource planning and strategic planning and business planning. And as a result of those gaps that we see in so many countries, there is a growing understanding that we need to have new expectations and new systems, and it's impossible to deal with this complex array of requirements unless we have a new generation of those that are managing and leading health services. As a result of that, then, we find a significant call for new forms of leadership development that is based on competencies. It would be wise for us to acknowledge that competencies in all languages and all cultures is a concept that integrates the balance of knowledge and skills and attitudes that are necessary for people to identify problems, solve problems, mobilize resources to implement the problems, and then to look at measuring the results that are being achieved and continuously evaluating and improving the performance of the system. And so on this screen, you'll see the third point, that is there a logic model that is powering this leverage that we know is so important to be drawn from better leadership? And those of us in this webinar, and many of you that have signed on to the webinar, recognize that the basic logic model flows like this. If we have stronger health systems, we're much more likely to have greater health outcomes, a greater health status that is not only more significant, but more likely to be sustained. And most of us, including the World Health Organization, the World Bank, the Organization for Economic Cooperation and Development, and virtually all of the multinational donors and increasingly private sector employers and capital investment organizations that are looking at the health sector to grow their penetration and activities, understand that it's impossible to have stronger health systems without stronger managers and stronger leadership. So good leaders create the conditions in which those that are delivering care and managing care are more likely to accomplish their needs. As a result, a large consortium was put together, and Lucy Nugent, who is based in Europe, will make some observations about the scope and nature of these health management associations and how they have tried to develop a response that helps acknowledge the importance of stronger health systems and the role that stronger leadership can play in that equation. So Lucy, thank you for joining the webinar from Ireland. We welcome you and look forward to your remarks.
Thank you very much, Jim. Can I confirm that you can hear me?
Yes, loud and clear.
That's good to know. Thank you very much for the invitation. And I'm just going to take over control of the screen, I think. Can you move the slide on, please?
Yes.
Thank you. It doesn't seem to be working from here.
We've advanced to
That's great. Thank you very much. Okay. So you can see from this slide, there's actually 17 organizations that participated in the global consortium under a chapter of the International Hospital Federation. And the directory that has been produced represents over 2 years' work, which sounds like a long time, but when you are dealing with this number of organizations with very varied health systems, it took a lot of time. So that was the first thing I would say was unexpected. I would also like to acknowledge, in fairness, the American College of Healthcare Executives and the Canadian College of Health Leaders were very generous in sharing their material, which the competencies are largely based on, but have been added to and expanded with input from other associations. When we first started examining this, we asked ourselves, what are we trying to achieve? There was a consensus very quickly met by the fact that, you know, the health system, the patients who use the health system, have a right to competent managers who are skilled in 6 critical areas, and that they have accountability and transparency, and that they're focused on service improvement. They have excellent educational standards, integrity, and a commitment to sharing and leading practices, and also to having equity and access to and delivery of care. And that's, again, was something that consensus was met with straight away. So we then felt, well, what are the competencies that you need to reflect this? And you can see in front of you there are 5 domains reflecting the core competencies, and they were derived from the Healthcare Leadership Alliance, and they were then circulated to the members of the consortium, who then further circulated them. So, for example, I'm, as I say, the Vice President of the Health Management Institute of Ireland, but I also sit on the Scientific Committee of the European Association, which is made up of 28 associations across 26 countries. So while there's only 17 organizations, there was a spread effect for consultation and engagement, which was very effective at trying to reach what we felt was a truly international approach. What we found, the barriers to effective leadership, though, are a lack of adequate training or preparation of healthcare managers, leaders, and the role of the healthcare manager is not fully recognized. In the actual domains itself, you can see leadership is the core competency, which basically intersects with the other 4 domains, and we are aiming to inspire individual and organizational excellence. The communications and relationship management, obviously there's a requirement that a manager, a leader, can communicate clearly, concisely, both with their internal stakeholders and their external stakeholders. There's obviously a need to establish and maintain relationships and have constructive interaction, obviously with internally and externally again. The professional and social responsibility, well, obviously it goes without saying there needs to be ethical and professional standards within the profession, and we need to recognize a responsibility which is primarily to the patient, but also to the wider community and to ourselves as lifelong learners. And that was, again, a key theme that we wanted to get across in that domain. And then as regards health and the healthcare environment, well, obviously, you need to understand the system. You need to know your business. And again, goes without saying that this is a vital component. And then the business element is, again, an area that maybe has been neglected in some health systems in the past, but less so nowadays due to the need for financial prudence, etc. We work in a much more regulated legal world, and there's financial considerations, there's human resource considerations, there's information management development. ICT is becoming a huge enabler, but also that we need to understand healthcare technology advancements and how we as managers can actually respond to that. So again, we felt that it was a very comprehensive overview in the directory. Next slide, please. So we now have this fantastic directory, but we don't want it to sit on a shelf gathering dust. So we felt, well, how can we move to the next step? We have reached consensus of core competencies for healthcare managers. We don't expect every individual on day one to be a master. They're going to start as a novice and have this an ongoing journey to reach these competencies. So we have approached government and non-governmental employers to see would they be interested in applying the directories. We have academic and commercial training programs, which we're looking at embedding these core competencies in. And then as individuals, we're looking at them from the issue of self-assessment and development. Next slide, please. And as I alluded to earlier, I'm part of the European Association of Hospital Managers. And we took these competencies and we said, well, how do they fit in with our objectives? And you can see there from the slide, developing professional competence. It's well recognized that the profession of healthcare managers is not well recognized globally. So it's not unique to Europe. So again, we felt this is applicable. And we also, as an organization, we tried to influence European-wide legislation. When I did a survey recently, we found that there's only 2 countries in Europe where you are required to actually have a formal standard of education to be a healthcare manager. So again, it's not consistent. And obviously, we're looking to collectively represent the healthcare management profession as a whole. Next slide, please. And again, our values, again, are reflected in the directory, which is obviously quality patient care and safety. The patient is central to what all of us here on the webinar are about. And operational excellence as individuals, but also as organizations. Professional development, which is key here for the directory. And the innovation and learning. And then the last point there is sharing across borders. And again, I suppose today's webinar is an example of sharing across the world, let alone just Europe. And then Ireland, I don't know if all of you know where Ireland is, so I included it, although we claim that Ireland has a relative everywhere in the world. We got that tiny little dot there on the edge of the west of Europe. So next slide, please. I'll just give you a brief view. How did we as an institute apply this directory? So just very briefly, we're in existence since 1945, so we're well established. We're the only government-recognized professional organization for health managers. Again, our objectives are to inform, educate, and involve our members, which again, as you can see from the previous slide, there's a common theme emerging about being informed, well-educated, but that networking piece is very important, because often I feel the best way we can learn is from the experience of others within the same worldwide health system, because the challenges are maybe dissimilar, but not that we're more alike than we are different. Next slide, please. So we have started involving including the directory as part of our competency-based interviews for recruitment of staff. We have engaged with the Department of Health, which is our government body, and the Health Service Executive, who are the Commissioners of Health Service in Ireland. And now they are establishing a leadership academy, and the directory is hopefully going to be part of that. They have taken it and asked, can they use it? So we're waiting to see the output of that. And also we have a Public Appointments Commission, which is where all our publicly funded agencies do their recruitment. And again, these competencies, we would argue, are applicable, the actual domains are applicable across many service providers. Next slide, please. You can actually, if you go to the HMI website, which is www.hmi.ie, we've actually started, we run a lot of training courses for health managers, and again, the competencies now are, all the training courses are being reviewed in delivering on these competencies. So again, the content has been adjusted to reflect the directory. Next slide. And then again, as I say, in Ireland, we don't have any formal recognition of the profession. There's no standardized evaluation, so there's a gap. So we feel that, again, using the competencies as a basis, we could develop a self-assessment tool or an actual online questionnaire to reflect the directory, pretty similar to the way the American College have done. And we call it accreditation. I think in the States you call it credentialing. So again, that you would actually have some formal qualifications for the profession of healthcare management. Next slide. So the actual directory itself is available on the International Hospital Federation website, and there's just you can find it under resources. And again, it's a very useful website, because it has a lot of other resources there that you are welcome to access and use. Next slide, please. So really, I suppose, you know, we have put a huge amount of work into developing this directory of competencies, but unless it actually becomes a dynamic and live document, it's been a waste of time. So we're actually calling on all those involved in healthcare to actually get involved, to look at the directory, see how it can be used. I gave you a few examples, but you know, it's not limited to just them. We're looking at, obviously, government involvement, academia, professional groups and associations, wider international organizations as well. They can use it for part of their developmental support to other countries through projects, training and job descriptions. Again, on the wider consulting firms, they can use it. And employers, again, as I say, we started using it in our recruitment prospect, but also as part of our continual professional development. And again, as an individual, it's sometimes hard to know where you are on your own career journey. So again, this is again a very clear roadmap for people. But really what we're trying to emphasize is this can be used in many, many ways. We are calling for everybody to certainly get involved, to look at it, and we would welcome also any feedback from today or ideas for the future. I think my email has been included. I'd happily take any feedback from anybody. I think I'm handing over to Temi at this stage.
Great. Yep, thank you so much. Good morning, good afternoon, everyone. This is Temitayo Ifafore. And I wanted to talk a little bit about USAID. So one of the things that Lucy said is that she called on everybody to take a look at this directory. And USAID has been one of the donors, one of the largest donors to recognize the importance of leadership. This is an area that we've been investing in since the 80s. And it was important for us to try to figure out how can you take something that currently, as you saw from the representation and the organizations that went into development, you had a lot of countries. You had Taiwan, you had middle income and upper income countries that put a lot of thought into this. USAID has a vested interest in really supporting lower and middle income countries to helping them achieve their health system strengthening goals. So when I found out about the Leadership Competencies Directory, my first thought is, well, how does this relate to some of our larger and broader health system strengthening goals? So today I'm just going to talk a little bit about what USAID's efforts are in health system strengthening, what our approach is, and trying to figure out and maybe articulate how we can apply these competencies and what this means. So as I mentioned, USAID has a long history of supporting health system strengthening, and one of the big areas that we are supporting is leadership management and governance. What I wanted to talk about today was USAID. All of the work that we're talking about falls within the context of health system strengthening. The USAID has developed a vision to action for health system strengthening, and part of the reason why I'm talking about that is because this is the framework that's guiding the way that USAID approaches its investments. The biggest concerns for USAID, especially around health system strengthening, is making sure that countries have the ability to deliver high-quality services that are responsible to their people's needs without incurring financial hardship. So I think that part of what's key here is where is the role of, what are the role of health leaders in really making sure that countries' health systems are responsive, that service delivery is happening in a way that's with dignity, and ensuring that people are getting access to the best care possible. One of the things that you'll see in figure number 3 is how we use and how we define health systems. I know for a while health system strengthening was a bit of a buzzword, but we're using the WHO framework, which has 6 different functions of it. I won't list them all out, but as you can see that there's a way and a role for leadership across all of these different functions to help countries reach their universal health coverage goals. I'm not going to go through this entire visual, but one of the key take-home messages that I wanted to talk about here was the fact that when looking at as Jim earlier mentioned, what is the theory of change? And the theory of change is that if we can strengthen the health systems in low and middle income countries, that we will be able to help countries achieve universal health coverage. Universal health coverage means that everyone is covered without hardship, that they have a basic, well-defined essential health package, that you're reaching the hard-to-reach, the underserved, and that you're being responsive to people's needs, whether that's hours, times, locations, and that your health workers have the skill set and the ability to do so. I think part of the other things that we are accountable to is you're going to see on the right-hand side of the screen is the 2 boxes around the health system strengthening impact. So what are we hoping to see at the end of the day? We are accountable to, I'm going to spell out some of these acronyms here, but we are accountable to ending preventable child and maternal deaths. Anything that we can do to ensure that our systems make sure that women and children are not suffering needlessly, and that there are a set of interventions which are well known, immunizations, making sure that people have access to care that can be implemented. That's what we're trying to do. We're also trying to make sure that there's an AIDS-free generation. It's our vision that within the next few years, that within our lifetime, you will have a group of people being born that are HIV-free. The last thing is, as Jim mentioned, there's a huge resurgence of infectious diseases and new things that are coming out that we don't yet know, we don't yet understand. And these types of pandemic threats are things that we're trying to be responsible to globally. As you know from the recent outbreak of Zika and last year Ebola, we're never going to know what's going to happen. So how do we make sure that health systems are able to anticipate and that they're able to respond quickly? And those are the types of health system strengthening impacts that we'd like to see. I think that the last piece that I'll mention, and Jim mentioned this a little bit earlier, is around the area of health finance. When we're thinking about the concept of sustainability, one of the key areas is how do we make sure that there's private sector engagement? USAID historically has worked with the public sector, and there's been more and more interest now in making sure that we can engage the private sector as well as the philanthropy sector in helping to help countries all work together to reach their health goals. So as Lucy said, there's kind of these 5 different domains, and USAID kind of has a different way of slicing it, but at the end of the day, it goes back to the importance of the people and the importance of the health leaders in making this happen. So the other area that I wanted to talk about, I talked a little bit internally about USAID's vision for action, but I also wanted to let you know and communicate how USAID collaborates with other donors. We recognize that in order to help countries strengthen their health systems, it's a coordinated effort. One of the areas that I'm going to give you an example of is from Human Resources for Health and helping and working with the World Health Organization on supporting the health workforce. The Global Strategy for Human Resources for Health is a process in which USAID and WHO and a number of donors have gotten together and said, you know what, we need to all work together. Countries should not be alone. It has to be a global effort if we're all going to strengthen the health workforce. And the reason why I'm bringing this up is because one of the key, as you see, number 3, one of the key areas in which this effort wanted to work on was strengthening leadership and governance for the health workforce. So some of that includes creating jobs, economic development, emphasis on career opportunities for youth and women, and really trying to make sure that the next generation of health leaders are prepared. This is just a visual of the complexity of the working relationship. USAID tries to work, one of the beautiful things about the last slide that Lucy had shown was that she kind of asked us to try to look at different ways that we can use the competencies across the systems. And the reason why the competencies are of interest to USAID is because USAID does work across a number of different systems. We work with donors, we work with countries, we are in over 150 countries. We're working with partners like Management Sciences for Health, who is hosting us today. We work with WHO and the Pan American Health Organization and the World Bank. So because the scope is so large, we actually feel that there's a huge opportunity for these competencies to also be applicable in the 150 lower middle income countries where we work. So what I wanted to do was just leave you with some resources that I talked about earlier, specifically the vision for the health system strengthening, talking a little bit about the strategic framework. The Leadership Management and Governance Project will tell you a little bit about USAID's investments over the past several years in leadership, as well as the Health Finance and Governance Project.
Just one moment, Temi, on that screen, for those on the audience, all of those are hyperlinked when you download the slides from the websites or look at the recordings. You'll be reminded about how to find documents within these resource areas.
So just to conclude, part of what we think is that by having a concrete set of competencies, ones that are usable, that are applicable, that are going to be able to be built into people's job descriptions, this will help every person understand what their role is in helping their organization, their country, whatever unit that they're operating in, reach their goals, their health goals. Thank you.
Thank you, Temi, and thank you, Lucy. We'll leave this slide up in front of us as we go into a question and answer period. Our moderator will be looking at questions that are posed to us from the audience. Just so you know, we have over 199 participants that have signed up and registered for this webinar. It indicates a broad interest in understanding what competency-based leadership development is about, and also we believe expresses a recognition of the importance of continuing the conversation about what are the key competencies and how do we develop them, how can we learn from each other. These participants come from over 40 countries, and they cover all levels of the economy. So that's encouraging for those of us that are participating in this webinar. I have a couple of questions, Becca, that I'd like to have responses from both Lucy and Temi, perhaps also myself. One of the things that you both have mentioned is the need for lifelong learning, and that many people can contribute to not only developing the competencies, but applying the competencies. And I know that both of you have seen one of the key ingredients for this is the need for health professional associations, organizations in a country that can struggle to mobilize resources, not only to make sure that there is education in the college and post-college settings for leadership and management, but also once people go into practice, that they're involved in managerial roles, whether they came from nursing or pharmacy or medicine backgrounds, that they have an opportunity for lifelong learning. So my question, starting with you, Lucy, and then to Temi, is how do you look at the importance of professional associations as a vehicle to use these competencies and to encourage lifelong application of them? You started to identify that in Europe, and I wonder if you would address that again, Lucy, please, and then Temi, your comments about that.
Thanks, Jim. Can you hear me?
Yes.
Great. Well, firstly, I suppose that the issue of being a lifelong learner, there are many ways to learn. It's not just at a desk, in college. It is learning from others. So one of the things is to have that opportunity to network and compare. And our association, it's one of our main activities is we provide events where we invite expert speakers to come along, and often it's over the cup of tea afterwards that people actually find out what's going on in the broader health system. But that is relying on people themselves taking the responsibility to actually attend those types of events. So really what we're trying to do is very much use the competencies to push forward the professionalization of healthcare management, that there is an expectation that people, once they enter into a role, will continue to develop, and the competencies gives them a framework for doing that.
And from my end, so this is Temitayo Ifafore. So just speaking a little bit about from the perspective of the lower middle income countries, I think the professional associations have a unique role in that they are at the intersection between, they have an advocacy role, so they're at the intersection between the workers themselves and the government. And so I've found that professional associations have a huge role to play, especially in terms of influencing national standards, setting and tracking and following up with workers to make sure that they do have the skill sets that are needed, that the competencies are then being rewarded, and those that do not have the skill set then have a plan or some sort of options to be able to get those skills. I think that one of the big challenges, continues to be having professional associations that are empowered, and this gets to what Lucy was talking about, which is professional associations really being recognized as the drivers and the representatives of the workforce. So I think that there's still a lot of work to do, but having a framework means that people don't have to start from scratch, that they actually have a way to go forward.
Mm-hmm. Great, thank you. Thank you for these presentations. We've had a couple of questions come in online, and I have a couple for you. The first one is, can you please talk about some of the differences in the skills needed by healthcare managers in low-income countries and high-income countries?
We can all respond to that. In my career, I believe that many of the competencies that are necessary and that need to be applied are quite similar. The style of application and the availability of resources to implement them, however, can vary directly. In the low and middle income countries, they face all of the same challenges that in Western Europe or North America, but their ability to get the right people, the right equipment, the right supplies, the right medicines, the right space, we call these the 8 rights, I won't go through all of the 8 rights, is more challenging for them. So they need the right competencies to approach their challenges, but their ability to have the resources to fully implement is a challenge. I don't know what, Temi, you have in terms of additional comments, or Lucy as well.
Yeah, I mean, I think in an effort The USAID approach has been, in an effort to address the fundamental issue of shortage of resources, has been trying to invest in resources that would be openly available. The Leadership Management and Governance Project has has offered a number of curriculums that would help organizations and help countries try to do it themselves if they wanted. USAID has also invested in an open source human resource information system that people can modify the code, and it will help them track people's training. It will help them track whatever it is that they need in order to be able to have a better sense of how to manage their workforce. So I think that, the perspective has been, let's try to eliminate some of the barriers. And if financial resources are a barrier, then let's make sure we're developing products that they can use openly, widely, make them widely available and disseminated. And then, but I feel like I support you. I echo what Jim said. I think the challenges are almost the same, but it's the resources and the complexity. And so in many ways, I feel like lower resource areas might have maybe one of their hands tied behind their back, but it's the same concept.
Lucy, you've worked with over 26 countries and associations dealing with developing managers and leaders. Do you see subtle or not so subtle variations in the need for an application of these kinds of competencies in Europe or even North America that you've seen?
Thanks, Jim. Well, I would actually take it one step further in that we tend to focus on finances as a limiting factor, or that impedes our ability to lead and manage change. But in actual fact, I think it's about creating that culture of innovation and change management. You referred to that earlier, Jim. So it's not all about money. I mean, Ireland, as many people might know, came through a recession where we had the Troika and the World Health Bank checking up on us every few months. And actually, while it was a very austere time in terms of healthcare as regards cutbacks, it actually produced some fantastic innovative approaches to actually developing our services, and even the way hospitals are configured now. We've gone into groups, which is like an NHS trust model. So I think it's creating an environment, and to create the environment you have to have strong leaders who are, I suppose, prepared to take that leap of faith and not always be constrained by money.
Great, thank you. That's a really great segue to our next question, which is, what are some of the challenges working internationally across all of these different health systems?
Lucy, why don't we start with you on this one?
Actually, that's a great question, because when I was presenting at the IHF Congress on the competencies, I used the analogy of dancing. So my friends in South America were doing the tango. I was doing an Irish jig. My UK colleagues might have been doing a waltz, and from that perspective, we all had a different style of dancing, but we all wanted to dance. So we all wanted to have the same engagement with music and movement. So it's about trying to find that common platform, and you come from a different perspective. All that, no one health system. There is no one global health system that is that has equity in terms of healthcare professionals, money, investment, technology. But the core principles are that we actually want to have a good health system for patients. So it's about starting with that core principle. You will have different challenges in different countries, absolutely. And the one thing was, it was very interesting for us all to come with different viewpoints and different priorities initially, but then actually developing that core central principle of wanting to have an excellent health service delivered and supported by strong leaders.
And I would say, this is Temi here, just to add, I think one of the benefits of working across different health systems is it provides the opportunity for what I'm calling cross-fertilization. I think one of the, there is a partnership, it's called the Medical Education Partnership Initiative, MEPI, in which different med schools from across sub-Saharan Africa got together. And you're right, Lucy, it's different dances, different styles, but the ideas that kind of came out of, well, here's how we're addressing this problem, and the discussion, I mean, I think that helped countries and the med schools try to come up with a different perspective. Yeah, I think that, you know, the sharing of experiences, yes, there's a challenge of trying to align different systems, but if your goal isn't to align them, but really to get more ideas out there, then I think that there are opportunities.
One of the organizations that we've seen evolve in sub-Saharan Africa to try and foster both the advocacy of the need for a profession in management and also to share learnings about curriculum and approach to competency-based leadership development is an organization called the Africa Health Leadership Management Network, AHLMN, and its secretariat is provided by the AMREF organization. It's approximately 29 organizations, largely training and academic and university type organizations. It's another way to leverage the learning, even though we face similar challenges, as using the metaphor that I love from Lucy, as we try to learn new dances and express ourselves in common ways, we need to look at linkages that go across borders, and organizations like the Africa Health Leadership and Management Network is one vehicle to sustain that continuous learning and to sustain innovation in how we develop and apply those skills and competencies.
Great, thank you. Our next question is, what is the evidence base supporting the value of healthcare management training for the healthcare organizations themselves?
This is an ongoing challenge, and it's one that those that participate in this webinar would be well advised to continually look to the literature and the growing body of knowledge that's being made available from World Health Organization, donors like USAID, and also the World Bank. These are a wide variety. Some are longitudinal studies that show that investing in management development for especially folks that have clinical skills are much more likely to show that the resources are in the right place at the right time, and that results in service utilization that is expanded. And if you can't deliver services or services aren't being used, it's very difficult to have a material impact in health gain. And also we find that immunization rates, reductions in maternal and infant deaths are much more likely to be moving in the right direction when you have leaders and managers that know what they should be doing and how they should be doing it, and they've got other clinicians and health workers and medicines available for them to accomplish those gains. So there's a large number of studies that are referenced. Some of those you can find in the website of Leadership Management and Governance Project that was referenced earlier in this webinar. And also there are a number of projects funded by USAID that are demonstrating a growing body of evidence that it matters to invest in leadership and management development. We see that also in Europe and North America. But it's an ongoing challenge to find that evidence and to remind the policymakers and the academic organizations and the employers that hiring good managers makes a difference, and in tangible gains that are not only more significant but more sustainable.
And I would just add, we're starting to have, you'll find a lot of retrospective studies that look at the effect of health management. I can come up with a couple of examples from reproductive health. They are synthesized in a high-impact practice brief. But one of the promising prospective studies that's coming out recently is coming from Cameroon, in which you had clinical interventions paired with a leadership intervention that control hospitals, and you're able to look at the difference in whether or not there are some of the service delivery indicators. And some preliminary data coming out of that shows that the leadership, the hospitals that actually had the clinical plus the leadership development actually were able to make greater gains than those that were not. And so, once again, I think that there's a lot of information coming out. I think that the field has demanded more evidence-based and more rigorous evidence-based, and so where possible, USAID's trying to look for opportunities to support more prospective studies.
Great, thank you. So here's another question from online. As a physician completing a Master's of Public Health at Hopkins who is pursuing healthcare management, what is your advice regarding work avenues for a beginner healthcare manager?
I can talk about that. Hi, this is Temi. I completed my Master's in Health Administration. So one of the exciting areas, and I know Lucy and Jim can talk about this, is that there's a lot of experience sharing that's starting to happen between countries, as well as from countries from the United States, North America, and Europe. And there's a lot of opportunities, for example, for organizations to find work who are supporting health facilities, both through consulting opportunities, through internships, through rotations, but there's a growing demand and a growing partnership. So one of the huge models that we've seen are twinning models. So U.S.-based organizations that have partners in other countries. Johns Hopkins has Johns Hopkins Medicine International, which is their international branch that actually does hospital administration in Mexico, South America, in Panama, in the Middle East. So that's actually right in your backyard, and that might be an opportunity for you to pursue. But I think that the growing trend globally is one of partnership and twinning. And so there are a number of organizations that you wouldn't necessarily think of that are trying to professionalize health management and are trying to share learnings across from one country to another. Jim? Lucy?
I would say it's very difficult to find your first job when you need your job, because everybody is, of course, looking for the experience that you have. You almost have to prove that you don't need any more experience for them to hire you. Or a crude metaphor is if you go to a bank, you have to show you don't need the money when you're asking for a loan. So what I would encourage this questioner to think about is to be very proactive and creative in how you design internships or fellowships following your graduation. You need to be working on this as you get ready to graduate. You can contact large health systems in the country in which you're graduating. In this case, you're graduating at a very respected university in the United States, but you may be coming from another country and may want to return to your country. So regardless of which country you would like to work in, it's important to think of the type of job you want and to look for and design a fellowship. It's more likely and easier for people to employ a fellow because they have less risk financially of bringing someone in and having them provide useful services, but also they can learn how effective and accomplished you are for longer-term employment. And so I think the whole idea of designing fellowships in the industry or the segment of health sector that you're interested in, I would remind all of us that in a study we did a few years ago for the World Bank, there are 22 significant segments in the health sector of any country. They range from protecting and promoting health by public health organizations or non-governmental organizations that are championing a particular health risk or cause, all the way up into community health leadership development, working in primary care, looking at small hospitals, working in the commercial side of manufacturing and distributing medicines and technologies and equipment, various forms of health insurance, and there's a growing private sector in many of the low and middle income countries. So there's lots of segments. Don't constrain yourself to think about only working in a hospital or in a ministry of health, but be creative as you look for those fellowships to ease your way out of graduate school or your pre-service into your opportunities for lifelong learning.
I agree, Jim. Lucy here. The wonderful thing about healthcare is that actually it's a great, the skills that you develop are applicable to many other areas.
Great.
Great, thank you. Our next question is, what efforts are being made to embed management training and knowledge locally so that it is localized and sustainable?
This is Temi here. One of the efforts, I think, and one of the approaches has to do with, I don't know if everyone's heard this, but I'm sure they have, which is, you feed a man for a day, or I'm totally going to mess this up already, I know. It has to do with fishes and loaves and teaching a man how to fish.
and fishing rods.
You're right. So I think the idea and the approach that seems to work the most is the training of the trainers. I think that by building local capacity, by making sure that every effort is partnered and that you're twinned with a local institution, that you're finding and seeking out, Jim mentioned earlier the African Health Leaders and Management Networks, seeking out networks and AMREF that have history, that have the possibility and the promise of longevity. Those are some of the areas that you want to invest in. Those are some of the institutions whose capacity you want to build. Inviting members from those into conversations, that's the kind of way I think and sort of the approach. And so, specifically for USAID, we've tried to work with organizations that have hubs in countries. AMREF has their hub in Nairobi. We're working with the International Planned Parenthood Federation. We're trying to work with organizations that will be there, that have been there, and will continue long past any sort of donor support.
Lucy, how do you see the embedding of this capability development into local institutions of various types?
Well, I think when every new manager joins an organization, there is an opportunity to sit down and have their continual professional development plan, and it should be reviewed at regular intervals. And then when the person's skill sets are identified, where there are gaps identified, additional in-house, as we call it, training or external training should be accessed. But equally, the role of mentoring and coaching is very important, and it can be done informally as well as formally. People tend to focus on the formal coaching or mentoring, but actually you can identify in your organization people with those skills naturally, support them and develop them as coaches and mentors, and develop that ongoing capacity internally, which I think is very important for organizations.
There's one question I would like our panel to respond to. I know that we're getting near the end of this webinar time, but I believe all that we've been talking about is really not going to amount to anything that's sustained unless we have a little bit of conversation, and that the members and participants in this webinar are active champions for and advocates for good jobs, jobs that have the right kind of recognition, that they're valued, that they receive good compensation, that there's really a career in health management. Because if we don't advocate for good jobs and to make sure that in the civil service systems that there are managerial categories that make sense, that build on these competencies, and that these jobs create opportunities for men and women that are safe for them to work, we're not going to have the sustained gains that we need. So my question for all of us, and Lucy and Temi can respond, but I'd encourage the people in this part that are participating in the webinar to think about is, what can we do with government and with private health sector organizations to develop jobs that are meaningful and that recognize that they have value and that they receive fair compensation, a living wage, because that's not always the case, as we know, in some of the low and middle income countries and even some of the higher resourced countries as well. So I'd first turn to Lucy as she looks at the need for accreditation and licensure, if you will, in Western Europe. What are you finding to be the ways that we can advocate for good jobs and careers in the managerial and leadership space? And then we can go to Temi as well.
Thanks, Jim. That's an interesting question, because actually what has been a common issue across Europe is actually attracting and retaining good healthcare leaders and managers. The average, I think, lifespan of a CEO in the NHS in the UK is less than 2 years. So I think we need to, by having a professional qualification or at least credentialing, accreditation, gives assurances, I think, to the government or to employers that these individuals are competent. They are people you want to attract. And then on the flip side, if you want that to be reflected in a good living wage, is people have to deliver. They have to actually perform at a high level, and that as well is a challenge given the healthcare environment and the level of burnout and people leaving the health system is a challenge now at the moment in Europe. So it is about making sure we have people who have the capacity, the capability to deliver, but that they are recognised appropriately.
I think that was pretty thorough. I want to leave time for one of the other questions from the field.
Okay, great. So can you please talk a little bit about how the directory and the LMG project address the different skills needs of clinicians in the field versus higher level administrators, especially in low and middle income countries?
One of the things that we have found in the Leadership Management and Governance project is it's very useful to start with people that have found themselves, often not by design, in managerial or leadership roles. Oftentimes these could be community health workers, nurses, or physicians. I can remember a very long conversation with a young physician in Kenya. He said, I've been out of practice only about 3 or 4 months, and I was thrust into running a small district hospital without any training or experience about what a budget was, how to supervise people, how to mobilize financial and medical and supplies that we needed. And I stumbled. And so it was very important for that individual to have had some special training in managerial development out in the field. We need to make sure that as in the low and middle income countries that we acknowledge that training can happen at all times and in all places. We've also found out that the worst thing is to do what some of our African colleagues have called hotel training. They leave their job for 2 or 3 days. They get all excited about new skills, new problem-solving approaches, and then rush back to an organization that is not supportive of them because they don't have a culture of teamwork and problem-solving. And so one of the challenges is to make sure that we are intentional about developing that managerial expertise among clinical-based folks and do the work in the settings in which they are working. Use case studies that come from their own situations. Apply the principles and the practices and the competencies to their real-world problems in the place that they're working. It's through those kinds of initiatives we're finding it's more likely that the knowledge is mastered and applied and therefore more likely to have gains that are sustained.
And I'd say, this is Temi here, just to add, I think most health systems are in transition. You currently see the clinician manager, that's the person Jim was talking about, where you have doctors, nurses, matrons, health officers who are in the management position. And so I think that part of the nice thing about having a competency-based approach is that you're not creating and designing something based on your administration or your job title. You're based on the function. And so regardless of what your title is, if you're acting and if you're making decisions on behalf of an organization, you're a leader. This competency is for you, whether you're a clinician, whether you're an administrator, whether you're on the front line, or whether you're in a setting that has a more established and well-defined cadre. And that's it. That's all for me.
Lucy here, I would absolutely agree. We have a saying, clinicians in management. And from that perspective, it's imperative. I don't think you can. It's like governance. We used to have corporate governance and clinical governance. Now we just have governance, because in the end of the day, there shouldn't be that distinction between whether you are a clinician, a manager. The core principles are the same, and the directory reflects that. I mean, the domains of leadership, communication, professional responsibility, the health system, and business are applicable to all of us.
The last comment I'd make before our moderator closes us up is that we've acknowledged that competencies are important. They're important because the health systems in which we're all working are changing. They face complex needs. It's incumbent on all of us to continually read, review, refine these competencies. They're available for you to download from the website of the International Hospital Federation, which you can find at ihf.org, and also the Leadership Management and Governance site, which you can find at lmgforhealth.org. Thank you all for participating, and back to you, moderator.
Thank you, Jim. Thank you, Lucy. Thank you, Temi, for a great presentation. Unfortunately, we are out of time for questions today. We have a few that we didn't get to, but we will pose them to our panelists and see if we can get some written responses, which we will post on our website, which, as Jim mentioned, is www.lmgforhealth.org. You can also continue the conversation with us. You can find the LMG Project on Twitter at LMG4Health. We're also on Facebook and Instagram if you want to reach us that way. So thanks again for a great conversation, and see you later.